Hi, this is the video presentation of ITECH1101 IT problem solving, assignment number 1 on COVID contact tracing. I'm Janam Gurung representing group 6 along with ARJUN Gurung and NABIN Adhikari. Coronavirus was first identified in Wuhan, China on December 2019. The virus causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes or exhales. These droplets are too heavy to hang on the air and quickly fall on the floor or surfaces. People can be infected by breathing in the virus if they are within close proximity of someone who has COVID-19 or by touching a contaminated surface and then rubbing your eyes, nose, or mouth. The bar graph on the left-hand side of the screen illustrates the number of COVID cases per each month starting from January 2020 to July 2021. The number has never hit zero, which means it's still spreading. On the other hand, we can see a pie chart which represents the top countries in context of COVID-19 cases. On number 1 is USA with 18.3% of cases, followed by India with 15.61%, and on third by Brazil with 9.85% of cases in compared to the whole cases identified throughout the world. Why is it spreading so much despite of the known cause of transmission of virus? I can only think of two things. Number one, it has no cure, uh, as the medical science has not found a way to defeat coronavirus. Number two, it's too hard to trace coronavirus as it takes 24 hours to get result after the test. Uh, Even if people have created a number of ways to trace COVID-19, it's still not that effective as a result people don't know who have COVID or not. They ended up getting exposed to COVID victim or the places they visit.
As we all know, due to this COVID-19 pandemic and the new instance have affected many people's life due to the drastic changes in the wide variety of COVID-19 cases. Contact tracing have been a crucial public health measure, as contact tracing helps to break the chain of human transmission with the aid of identifying human exposure and provide quarantine and treatment if they present any symptoms. Some of the common apps that have been used are Zigbee, QR codes, and BigTech. While using these apps, various problems have been arise, like lack of perfect system, unclear instruction, record retaining being difficult and time consuming. So some of the basic possible solutions apps that can be used for contact tracing are COVID Safe, National Health Service, and Google Exposure Notification. Furthermore, the feasible option for COVID-19 contact tracing can be finished by a few approaches apps like social media tracing, manual contact tracing, and Trace Together.
Tracing solutions for the COVID-19 virus that we are going through, and based among the solution we find, and I'm here for analyzing the solution we found and selection of the best ones after a long decision making process. Most of the solution we found needs internet, and only manual contact tracing doesn't need internet. We know we can't have internet and mobile phones with us all the time, and even everyone are not connected. We have done a lot of research and found some COVID tracing app. Some of them are National Health Service COVID-19 app. This app was launched in England and Wales, which sent out 4.4 exposure notification for every user who had tested positive. But the evaluation of this app has not yet been peer reviewed. This is the British app. And another one, we have social media tracing. It is quite fast method of tracing, but everybody is not connected in the social media, especially the older people, and they are the most vulnerable group. And I think this cannot be used as the best solution. So then we have another app for the Australian people, that is COVID Safe app.
COVID-Safe app is mainly used to check in any location through the help of QR code. This app is used in NSW. True, it doesn't notify people who have COVID nearby, but uh, through this app, COVID-infected person visit location can be traced, and NSW government can notify people who had close contact with the COVID-infected person. We have come up with a decision matrix table as shown in the screen. We have evaluated the 5 possible solutions in regards with tracing time, user-friendly, technicality, cost, and ethical. We have compared all these 5, and the result of the decision matrix gives the COVID app as the best possible solution. Thank you.